I'm Dr. Sunil Kukreja. I am a research fellow at Louisiana State University Health Sciences Center, Shreveport. If you look at the background, the role of BMP in a lumbar fusion has been very well established. On the other hand, the use of BMP in cervical fusions has been a controversial issue. Baskins et al. Were the first authors who conducted a randomized controlled trial, and they observed very good results, and they did not report any complications related with the BMP. There were several other studies which were performed afterwards which reported high incidence of complications with the use of BMP. One of the study was from the Shields et al. They reported high incidence of complications, and some of their patients even had readmissions for the exploration of neck swelling. We performed a retrospective analysis of 197 patients who underwent anti-cervical fusion in last 5 years. The most common indication for the surgery was herniated disc prolapse. If you compare our findings with the previous literature, as we have already discussed in a background, that there's been a high incidence of complications which are associated with the use of BMP in SCDF. We saw only 2 patients who had a prolonged hospitalization, and the complication rate, the dysphagia and the neck swelling, the incidence was comparable to the other studies which had performed the anterior cervical fusion without the use of BMP. We believe that the low dose BMP is associated with a lower rate of complications. The take-home message is, as it is very relevant that the BMP is associated with high incidence of complications. But if you look at the dose, if we can just use the lower dose of BMP, and in most of our cases we place the BMP only within the cage rather than placing outside the cage, I think with this technique we can reduce the number of the complications associated with the BMP, and we can increase the safety profile.